Hi, I'm Dr. Mangesh Kamath. I'm a senior consultant and additional director of medical oncology, hematology, and bone marrow transplantation unit at Fortis Hospital's Cunningham Road, Bangalore. Bone marrow transplantation is a niche procedure. Transplanters such as me are not enough. You require a bone marrow transplantation unit, which is a very sterile unit, and it requires a lot of investment. In our country, there are many patients with both benign conditions and malignant conditions who require to undergo bone marrow transplantation. The benign conditions are thalassemia, sickle cell anemia, and many more. And the malignant conditions are leukemia, lymphoma, and myeloma. In many of these conditions, bone marrow transplantation becomes the most important treatment procedure by which you can cure these patients. If that is the case, why don't we have that many bone marrow transplantation units? You may ask. For our country, with that population, in that number of patients that we have with benign and malignant conditions, we require more than 10 times the number of BMT units that we have today. But the problem is money. It's difficult to install a BMT unit. And today I am going to show you how many hospitals in our country will be able to install efficient and cost efficient BMT units in our country. Every bone marrow transplant unit has got its CAPEX and OPEX challenges. CAPEX is the cost of installation of the bone marrow transplant unit, and OPEX is the operating cost of the bone marrow transplant unit. And many a times it's difficult to give affordable bone marrow transplant costs to the patient because of these two major factors. PneoTerik, which is a positive pressure dealing company, is actually providing a very innovative form of bone marrow transplantation unit installation. It involves a lower capex where the HVAC or the heating, ventilation and AC leveraging is existing for the split AC that is available in many of the private rooms in the hospital. There is very low power consumption and there is very low operating costs. The maintenance of these units is very low compared to many of the other AHUs which are present in many of the centers. It is easier to maintain. It is also having a lot of mechanisms to avoid leakage, and the sterility is second to none. So make sure that you get more information about it in their website, and I will definitely be happy to show you what we have achieved at our transplant unit at Fortis Hospital's Cunningham. You can see here, this is a double chambered bone marrow transplant unit. So the split AC that is already there provides the air for cooled air inside the unit, but the patient is not exposed to this air. The air that is then released goes into the inlet of the positive pressure unit, the AHU, which takes in the air, and that air goes inside after the filtration process under positive pressure. This is an infection control unit wherein the air is actually in a positive pressure. The pressure of the air inside the room is much higher than this area. So once you enter the room, you can see here from bottom to top, it looks like as if you are in some sort of a space unit. You have the sterile walls. They are not going to get any infection or any coating. You can use the regular antiseptics to clean, and all the surface disinfectants can be used without much of a problem. If you can see here, there is a vent where the filtered, purified, sterile air comes down, and this whole room gets only this air at a positive pressure. the differential of pressure from inside and outside is going to be much higher, and there are multiple mechanisms wherein you are avoiding any sort of patient contact unnecessarily. Let me give you an example of that. We do not install any IV fluids that is to be changed by the nurse by herself or himself. We have a vent through which the IV fluid tubes will come inside the unit and help to hydrate and give treatment to the patient. Even if the patient requires any food or any other extra bedding or clothing that comes from this trans chamber unit, it can be opened, even that is sterile. If the patient needs to visit the washroom, then the patient goes here, and this unit is also very well protected from the positive pressure loop. So this is very unique, very easy to maintain, and very cheap compared to many of the BMT rooms which I have witnessed being installed earlier. To know what is the sterility of the air and what is the positive pressure that is present inside the unit, you have this handy iPad that is installed outside. We have a Wi-Fi connection to this unit, and you can see real-time display of the temperature inside, the humidity, the deep unit. You can provide the maximum aseptic conditions to the patient, especially when those patients are in deep neutropenia. It is extremely useful to have a unit like this where the chances of infection by air, by touch can be reduced to as much as possible.